checking a mechanically ventilated patient. As you know, there is no possibility to take any history, and we're using our Navi device to check the patient. My favorite probe is this probe. This is the phased array P41 probe. What I love about it is that I can perform both the emergency mode fast and the cardiac mode using the same device, but on same modes, on different modes. So what I'm gonna do right now is I'm gonna show you his lungs. This patient had pneumonia, and he had a collapsed lung at some point. Now we're checking his right lung. As you can see, I can easily adjust my depth. We can see the A-lines over here, over his lung. We're going through different intercostal spaces. We can see that he still has B-lines over his right lung. What I'm really interested in is to see if he has any lung collapse. So now I'm working through his axilla. On the right side, I can see B-lines going down, and now that's his liver. Going a little bit up, adjusting my gain, and I see there is no lung collapse. Why there is no lung collapse? Because I can see the A-lines. If there was any lung collapse, I would see an air bronchogram. This is the guy's liver, and we'll get to the liver a little bit later. All right. So this was his right lung. The left lung, same thing. I start with the apex of the lung. I can see that he has A-lines going down. That's his heart over here. We'll go back to the heart later. And we're going through different interspaces. And now I'm going through his left axilla. And we see A-lines going down, A-lines going down. That's his spleen over here, and there is no lung collapse. Now, very simply, if you want to look at his heart, go to exam, press adult cardiac mode, and I can now perform a heart examination of a mechanically ventilated patient that does not cooperate. So it's really easy to perform the echo. This is his heart over here. We can see the heart chambers very, very clearly on the left side and on the right side. We are going to decrease our depth a little bit. And here we have the left ventricle and the right ventricle, and we see that the left ventricle is contracting normally, the right ventricle is contracting normally. There is no pericardial effusion. This is a two chamber view here of the left ventricle, and we see that the left ventricle is normally contracting. When I see the vena cava, I go down over here to his abdomen, and this is his vena cava over here, and I see he has a normal vena cava that undergoes respiratory collapse. If I want to look at his kidneys for some reason, I go back to the EM fast mode, apply some gel, go to his right side, and voila, this is his kidney. See, it's really, really simple. He doesn't have any hydronephrosis on the right side. The kidney is normally shaped. This patient is not fasting, so the gallbladder would not be distended, but I'm gonna try to see his gallbladder. I guess this is his gallbladder over here. It's a little bit constricted because he's not fasting. On the left side, I'm going to his left kidney right now. This is his left kidney. Very, very easy. No hydronephrosis. If I want to see his urinary bladder, it's a piece of cake. Take the transducer above the symphysis pubis. This is his urinary bladder. If I want to make measurements, I can easily freeze the screen and make any measurements I like. But if I don't want to make measurements, all I need to do is go a little bit higher towards his umbilical cord, and I see that the bladder disappears, which means he does not have any bladder distension. So this is a normal bladder over here. So thank you so much.